Hey, Dr. Jerry Williams here to talk to you today about folliculitis or ingrown hairs. Now, you're going to see me looking down at my screen here because there's a long list of causes of folliculitis, and I want to make sure that I don't forget any of them. So, folliculitis is an inflammation or an irritation of the hair follicles, and it's a very common problem. I personally have experienced it around my neck or my beard line in the past, and we'll talk about that kind of folliculitis. But we see this very commonly in our urgent care centers nationally, in our urgent care 24/7s, and I thought it'd be something that would be good for us to talk about. If folliculitis goes untreated, and if there's a bacterial cause, either primary or secondary bacterial infection, these folliculitis infections can go on to cause an abscess formation, can be really problematic. Also, if they involve an ingrown hair, unless you remove that ingrown hair where the hair is actually growing back down into the skin, if you don't get that hair removed, or at least get it pulled where it's growing away from, not back into the tissue, that folliculitis is actually not going to resolve back to normal until the ingrown hair is taken care of. Now, there's lots of different causes of folliculitis, and I want to kind of run down the list. One thing is that iron deficiency anemia is sometimes associated with chronic folliculitis. So one good reason to go get evaluated by your primary care physician if you think you may have, if you have chronic folliculitis, it could be iron deficiency anemia. There are bacterial causes of folliculitis. Most commonly, it's Staph aureus, which is a super common bacteria that grows on the skin. There's also hot tub folliculitis, which is caused by a bacteria called Pseudomonas aeruginosa, which is also seen in cystic fibrosis patients and in burn patients. Actually, I did a basic science research as an undergraduate on Pseudomonas aeruginosa prior to going to medical school. There's also Psychosis barbae, which is called Barbers itch, which is what I described, where I had a folliculitis of the follicles around my neck where I would shave. There's also a condition that's similar to that we'll talk about here in a second. And then there's Gram-negative folliculitis, which can appear after prolonged acne treatment with antibiotics. There's also fungal causes for folliculitis that includes yeasts, and there's an infection caused by the fungus Tinea rubrum, which can cause a fungal folliculitis as well. Viral folliculitis related to the herpes simplex virus can happen. It's pretty unusual. And then there's non-infectious causes, like there's a Pseudofolliculitis barbae, which is a disorder that occurs when the hair actually grows back into the skin, and that's in patients like myself who have very curly hair. There's a whole list of folliculitises that can be related to chemical exposure, oils, but mostly those are folliculitis that are related to kind of a localized dermatitis or folliculitis from oils that are used to moisten or to treat the skin. So if you use a new product and you start having symptoms like that, the answer to that is stop using the product, wash it with soap and water, and typically those are self-limiting and they'll resolve. So the treatment that we typically do with folliculitis and ingrown hairs, number one, we remove the hair and get the because that's the inciting problem that's causing the inflammation that sets you up for infection if you have an ingrown hair. But then we will treat with typically topical antibiotics that are very effective, and exfoliation, meaning getting rid of the dead skin, is important, and frequent antibacterial soap use is also useful. And then using moisturizers that are gentle, which will also keep the skin healthy, and you're less likely to end up with the folliculitis. So this is a common problem. A lot of people have it. We've run down the laundry list of causes, and Thanks for letting me use my list there, because again, I didn't want to forget anything. So if this is a chronic problem for you, I can encourage you to go see your medical provider so we can get the correct diagnosis to get you on the right treatment plan and get you better soon. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.